Hi, I'm Rachel Shelton. Welcome back to the module on implementation science. We're going to be talking now about how you might go about selecting evidence-based interventions. So broadly, when we think about evidence-based public health, Ross Brownson and colleagues have kind of put forth some characteristics of evidence-based public health. So some of that is using kind of best available quantitative or qualitative evidence or data to inform decisions, using that information systematically, applying program planning frameworks, engaging community and stakeholders in all the decision making, conducting and building an evaluation, and then again disseminating to the stakeholders. So not just involving them, but then actually making sure that they can use the information moving forward. So again, as we think about evidence-based public health, we have a huge wealth of information in terms of existing programs that have already been found to be effective for a number of different areas. Why would we potentially want to start with an evidence-based program that already exists versus developing from scratch a new one? So I think this is always a tension and one that we have to decide what makes sense. But often, again, there's if you start with an existing evidence-based program, it's a nice starting place. There's already some suggestion that it might be effective, and it can help build the evidence base for an intervention. So if you're doing it with a new setting or population or context or different level of resources, you can help build the evidence base that a program works across different contexts or settings or populations. It can also be cost effective. So it can be hugely resource intensive, time intensive to develop interventions from scratch. And I think we often underestimate that. And so I think that's another important reason to potentially start with an existing program. And it can also help focus our evaluation because often there are existing tools or measures that we can use to inform our work. There are also examples where you may need to start from scratch. So for example, if you're doing a completely different health issue or health topic, it's often too much to kind of take an existing program, that was tested in one specific issue and say you're going to adapt it for a completely different health issue. So I think there are areas where it doesn't make sense. But in working with your partners and your stakeholders, you all need to select an evidence-based program that resonates with you all and ideally has some level of effectiveness as a starting place. So often in the field in implementation science, people talk about EBIs or EBIs or evidence-based interventions. And broadly, that just means interventions, again, that have some level of efficacy and or effectiveness, meaning that it's been tested in some kind of evaluation and that there's some suggestion that it's effective in improving whatever health behavior or health outcome or social determinants of health-related issue that you are interested in. And again, we'll talk about how the level of evidence, there's no one right way to approach that. But in the field, when people talk about that, that is what they're referring to. And in many cases, but not all, there's been some kind of rigorous randomized control trial. And again, often that has been the gold standard in the field in terms of establishing an evidence-based program, but that is not always feasible. That is not always the reality. And so again, there are some parameters in terms of what that looks like. But when people say evidence-based interventions, they're broadly talking about programs. This might be multi-level interventions. This could be practices. This could be processes, policies, guidelines. So again, that term is quite broad. So again, what counts as evidence-based? So again, just thinking from what we might consider an implementation science lens, again, these are programs that have been proven to be effective at different levels of research. So the highest level is not always possible. Again, that would be one that's been funded by a peer-reviewed grant. It's been published in a peer-reviewed journal. It might be included as part of a systematic review of interventions or guidelines. You may be familiar with the Guide to Community Preventive Services, which includes best practices for effective public health programs. The Community Guide also has a health equity focused programs as well on their website, which I would encourage you to look at. So ideally, whatever the program or practices would align with their recommendations. But you always have to step back and ask yourself kind of what's the best available evidence we have to work with. There's lots of resources that compile evidence-based interventions, and I think a lot of people don't know about these. So there's actually a wealth of information. One way that you can think about this are these databases, which I'll tell you about. You can also think about doing a literature review through PubMed or Web of Science. You can brainstorm search terms related to the topics. And again, things like the Community Guide or Cochrane Reviews are great resources in this area. I also recommend that people talk to experts in that area or reach out to authors. So we often find that people don't actually publish their full intervention. You often just have the research findings. So often there's huge gaps in terms of what the actual intervention or program was. So I always encourage people to reach out to the researcher or investigator or community lead to learn about the program. And I find that people are really generous in terms of sharing information and resources. So again, there's already great programs that kind of rank different community-based programs and policies and clinical programs as well. So there's the Guide to Community Preventive Services, which has a wonderful website and resources. There's SAMHSA, which has the National Registry of Evidence-Based Programs and Practices related to substance use and mental health. There's Cancer Control Planet and RTIPS, which is the Research Tested Intervention Programs. This is generally related to cancer very broadly, so anything from physical activity or obesity, ranging all the way to screening and survivorship. This resource in particular has a searchable database by setting, population, age group, geographic region, populations, topics, and often they will actually link to the actual material. So it'll be, an implementation guide, a training guide. It's really, really detailed in terms of the materials that are accessible. So that's a great resource to check out as well. The Canadian Best Practices portal has lots of community health and population health interventions and policies. In terms of HIV work, the Diffusion of Effective Behavioral Interventions website is a great resource through the CDC, as well as the Center of Excellence for Training and Research Translation. So again, there are a variety of kind of community public health and social determinants types of intervention databases that are available. And then for people who might be doing clinical work, there's lots of systematic reviews and evidence-based guidelines, Cochrane, the Campbell collaboration, the U.S. Preventive Services Task Force. So again, lots of evidence and reviews there as well. Here's one example through RTIPS. So this is the program that I work with of community-based lay health advisors and African American women who lead this kind of empowerment-based systems navigation lay health advisor program. So this program is amazing. So they kind of identify through the website the need, the program, how it aligns with the Community Preventive Services Task Force, how much time it will take, the audience, what the resources are, what the evidence base is, and again, it links to all the materials. So again, this is a really exceptional resource. So when you and your stakeholders are thinking about an evidence-based intervention, and again, making the decision about developing your own or starting from scratch, you always have to think about this as kind of a puzzle. So it's not just about what the research evidence is. When you're thinking about this decision, you have to think about the population characteristics. What's the population that you're working with? Is there a program that matches their needs? What are your resources? What's feasible in your context? What's the kind of knowledge level, or who's the implementer who will be delivering this? What do they need to have in place in terms of support and training? And what's the kind of policy or organizational context? Would the leadership be on board? Would you have the financial support? Is there a champion for this? So again, it's not just about the evidence and does the program work. It's about these other factors as well. And in some cases, we'll have a whole section on adaptation. In some cases, you may need to adapt the program for your population and setting and context. It may not reflect or may not have been found to be effective among a population that reflects the population that you're working with in terms of maybe socioeconomic status or geographic location, rural or urban, or racial and ethnic diversity. And that is really, really critical to think about. So in some cases, you might be selecting an intervention and needing to make some really critical adaptations, which we'll be talking about. But again, this should not be in isolation. This should not be you as an individual, alone thinking about, I think this intervention sounds good. This needs to be something where you are working actively. This is an active, engaged process with your partners and stakeholders and the people who would actually be receiving the intervention to make sure it's feasible, acceptable and appropriate, and could actually be implemented and sustained, ideally. So again, always thinking about the program fit. Is it a match between the community's needs to determine what will be appropriate? In some cases, you may need to do a needs assessment or an assets assessment to identify what might be a good fit, what the needs are, what the priority issues are. Again, thinking about organizational capacity, what are the resources, organizational commitment, and community buy-in that would need to be in place, and what program might reflect that. And again, then thinking about selecting a program. So again, this is really kind of a collaborative effort. And as we'll be talking about, in some cases, this may require some program adaptation. So again, as we talked about, it's not just about the research evidence and looking at outcomes, but thinking about what are the outcomes that there's evidence for, are they actually meaningful to partners? Has it been studied again across multiple settings and populations that reflect your setting? And again, also bringing in your own professional judgment and expertise, involving community input, their own kind of prioritization and input on this is really, really critical. Because otherwise, again, if you're doing this in isolation, the chances are you won't have the organizational and community commitment. And I think that if you kind of go in there and try and implement a program without that buy-in, it can really set you up for kind of failure and kind of erosion of trust in terms of that partnership. So it's really critical that it's a collaborative effort. There's a great tool called the Hexagon Tool, which I actually have used with my community partners. And I think across different types of settings, it can be a great resource. So basically what you do, you can print this out if you Google hexagontool.com, and here's kind of the PDF link at the bottom. It has you as an individual or as a team rank for a particular intervention, how well you think it fits, how well it aligns with the resources you have available, what the evidence is like, how ready you all feel in terms of being able to implement it, what capacity might need to be built, how it kind of meets existing needs in the community or with your partners. And I think you can either do this individually and then come together as a group and make sure people are on the same page, but I think it's a really nice way to kind of get feedback, either informally or formally, about the potential fit of an evidence-based program or practice that you're selecting. So a few considerations just to wrap up. It's always important to step back. Again, often researchers sometimes have this lens that that only certain types of evidence should be considered, but the real world is that you have to think about different types of evidence. So again, there's the research evidence, but the experiential evidence, the community evidence, that input is critical to this being successful. So when I think about evidence and implementation science, that's very broadly determined. You have to think about, again, whose perspective you've considered, who was involved in either the development or the selection of the intervention and program. Are all the key stakeholders, have they all been at the table? Because that will have huge implications for your success in implementing the program. And there's some really interesting work coming out on designing for dissemination. So again, as we're even thinking about as program planners or developing interventions, developing them with dissemination in mind from the beginning. So not developing these complex, costly interventions that are too much for community settings or lower resources to actually implement, but from the start, delivering things with the stakeholders involved from the beginning, and bringing in principles from user-centered design. So that is kind of a growing focus as well within implementation science.